In the previous video, we have already learned about the anatomy of forearm, the radiological anatomy, and Galeazzi fracture. I will link the video in the description box below. Now, with that basic understanding that this bone is radius, this bone is ulna, this is our wrist joint, and this is our elbow joint. We can now proceed to the next type of fracture of the forearm, that is a Monteggia fracture. In Monteggia fracture, we have two components mainly. That is fracture of, here we have a fracture of distal 1/3, proximal 1/3 and distal 2/3 of your ulnar bone, and which is associated with disruption of, as you can see, there's disruption of radial head and capitular joint. So radiocapitular joint is disrupted, that is capitulum and radial head are far apart. So these are the two components which lead to something known as Monteggia fracture. And for that, to check Monteggia fracture, you have to take a radiograph of the forearm including the elbow joint. Just like your Galeazzi fracture, Monteggia fracture is also treated with open reduction and internal fixation. That is the treatment. But if the radiocapitular joint is stable, then we can also do closed reduction. So this is the basic of Monteggia fracture.